Now at 4:30, we continue our coverage of the coronavirus pandemic. Today marks 1 week since a containment zone went into effect in the city of New Rochelle. That bold action aimed at stopping the spread in New York's first cluster. So is it working? News 4's Marc Santia shows us how this resilient community is trying to stay strong.
Mobile testing opened up here on Glen Island Park a week ago. Hundreds of people are being screened across town. Neighbors are banding together. 1 week into the state-established coronavirus containment area here in New Rochelle, volunteers and the National Guard are making sure residents have books and food to get them through this crisis.
Disbursement of food continues. It has been difficult because other pantries and locations in Westchester County are also in demand. The community has really risen to the occasion.
These guys are here helping the community. I'm part of the community, and the least I can do is give back.
Delivering food to the volunteers, Robert Hayes from Beachmont Tavern. This New Rochelle business owner says
there's hope now, that everything, few short weeks should be getting back to normal.
The community holding on to hope after a positive social media update from the wife of New Rochelle's first case. Adina Garbuz saying, quote, Lawrence is awake and alert and seems to be on the road to full recovery. He still has healing to do, but is on a very good trajectory.
He's back up and talking. He's sitting up in his bed. He's speaking. It gives us hope that we can get through this.
Back outside the containment area, Daniel Benet says they are getting ready for a big day tomorrow. More food and more National Guard troops to feed New Rochelle.
We're actually getting double the amount of National Guard. We are getting close to 8 pallets of food that we will be packaging ourselves. 600 to 700 packaged meals will then be distributed to 2 other sites that we're working with and in our site as well.
The containment area is scheduled to remain intact for the next week. The governor says then he will reevaluate the situation. In New Rochelle, I'm Marc Santia, News 4 New York.
We want to take you live to a press conference now with
Mayor
Bill de Blasio.
Our government couldn't be stronger. I'm going to talk honestly and bluntly about what we need from our federal government and how crucial that is in the equation. The City of New York is working constantly to protect our people. I know the state of New York is doing the same thing, and we are coordinated and share goals and strategies, but we all are waiting for federal help that still is not arriving. And that is the central challenge. We have to talk bluntly about that, and I will today. But to everyone who's dealing with this confusion and these challenges, I feel it, my family feels it just like you. We're all trying to make sense of a new reality. What I'm going to try and do every time I give you an update is tell you the blunt truth. And I'm trying to do very hard to make sure I tell you what we exactly know, and when we're not sure about something, we need to be clear about that too. It would be a mistake to tell you something certain if we're not certain. It would be a mistake to hold back things that you need to know, and it certainly would be a mistake to sugarcoat this very, very painful reality. I think New Yorkers want real talk. I think New Yorkers like it straight, and we're going to do that. So I'll be talking about several things today that are really painful and troubling. And I want everyone to understand that. I am not here to give you false reassurance. I have a lot of things I'll say that should cause you to be confident about what we can do in this city. Confident particularly in the fact that we have the finest healthcare institutions, the finest doctors and nurses, and all the people who work in our healthcare facilities, the lab techs, everyone who works in our facilities. There's literally no place on earth with a stronger and better healthcare sector than New York City. Nowhere on earth. And we are going to ask of our colleagues in healthcare so much in these coming weeks. They are already heroes, but they're going to have to work in battlefield conditions. Their strength, their courage, their resilience are all going to be needed. We're all going to be depending on them, just like we depend every day not only on their work, but on our first responders and so many of our public servants. Everyone is going to be needed. Everyone needs to answer the call. Everyone needs to step up for the good of everyone else. But despite my tremendous confidence in our people and our ability to serve them, I also have to be very clear about the extent of this crisis. It is unlike anything we have seen outside of wartime, with the possible exception of the Great Depression itself. We can make obvious and powerful, painful parallels even to things like 9/11, the days and weeks after that. But this crisis is even more unknown in many ways because we don't understand the exact trajectory we're on. And we know it will reach very deep into our communities. That is not a reason to be hopeless by any stretch, because remember, every single piece of evidence we have continues to tell us that this is a disease that for 80% of those infected will have very little impact. So I want people to think about this. I'll tell you a lot of things that are tough and sobering, but I want you to also remember this side of the equation. There will be many New Yorkers who never get this disease, and there will be many New Yorkers who get this disease, approximately 80% who get it, and will feel very little and experience very little. But those 20% who experience a much tougher time with this disease, the people in particular who are older, and that means particularly folks over 50 and especially over 70, and it means those, of course, with those serious pre-existing conditions we talk about so often: lung disease, heart disease, diabetes, cancer, and compromised immune system. For those people, particularly if they're over 50, we're worried. And we need them to take extraordinary measures. We need you to take extraordinary measures. If you're in that category of people, we need you to live differently. And we need your families to adjust as well. You're going to hear from Dr. Barbeau in a few minutes, and she's going to talk to you as the city's doctor and give advice directly to New Yorkers in light of an ever-growing crisis. But I heard from a friend in Brooklyn from the Midwood community just yesterday, and he said something I thought really captured it. He said, in a very tight-knit